Welcome back to another edition of the Hart2Heart Podcast. And my guest today is Dr. Ben Rein. He's a neuroscientist from Stanford. So, Dr. Ben, welcome to the show, brother.
What's going on? Thanks so much for having me.
Yeah, so I really want to chat with you for so many different reasons today. You put out a lot of good subjects, a lot of things a lot of people are interested in, particularly about drugs, obviously about neuroscience, but you talk, about MDMA, SSRIs, the things that, people are taking these days and things that people are very interested in learning more about. So, there's a lot of different reasons why I wanted to chat with you, but those are some of the main ones. So just before we kind of get into it though, can you just give the audience a little bit of a brief background about yourself?
Yeah, definitely. So like you said, I'm a neuroscientist, a researcher. For those in the academic world, I'm a postdoc. That means anything. For those outside of the academic world, it's like the equivalent of a residency that doctors do, but for a scientist. But yeah, I'm at Stanford. I'm researching empathy, and the project that I'm currently just about to publish is looking at the mechanism of how MDMA enhances empathy, which is why I tend to talk about MDMA quite a bit because it comes up a lot in my research. But yeah, aside from that, I do a lot of science communication. I just sort of by happenstance found myself on social media talking about neuroscience related topics and answering questions. And I have found that to be such an incredible pleasure and, not only pleasurable for me and enjoyable, but really valuable and important resource, I think, for the world, and something that a lot of academic scientists don't get a chance to do or don't make time for, but is really important.
Yeah. And, I'm certainly glad. And I think a lot of people are happy that, there's scientists out there like you that are researching MDMA because we do need to know more about it. And, the topic of empathy is something that's very interesting because, right now in the world, we can almost say this about almost any period of time in the world, but there does seem to be, a lot of anger, a lot of outrage going on. And, I do think we could definitely increase, the overall empathy in the general populations. And we do need people out there, trying to look at this kind of research. But before I kind of ask you about the research, how would you actually define empathy, Dr. Rein?
So there are a few definitions, I suppose. The one that I like and the one that makes the most sense to me is the sort of stepping into another person's perspective. And that can happen on a couple different levels. It can happen on a cognitive level where you're sort of imagining what they're going through and putting yourself in their shoes in a way of trying to understand their experience. And then it can happen on an emotional level where you are not only understanding cognitively what they're going through, but also sharing that experience. And so that can happen in a number of ways. If you see someone, you see your kid get an award and your kid's just beaming on stage and you just feel that like internal joy and happiness, like that's empathy. You're sharing their emotions. On the other hand, you see a guy get kicked in the nuts and you just feel that like, oh, like that sense, that empathy for that pain. That's empathy too. It's exactly that, just the sharing of another person's perspective. But it also within that has that element of understanding another person's perspective.
Yeah, I think that's a very good point. So a couple different things. I think stepping into someone else's shoes, we always hear that all the time. I don't think people necessarily really delve into that quote, like as much as you did just then and really, explain what it really means. But, when you are, trying to put yourself or see something from someone else's point of view, you are in fact being empathetic because you're trying to understand their particular situation, why they're behaving or acting, a certain way that they are. But when it comes to people who, maybe who are not that empathetic or wouldn't have those particular characteristics, and this is something that, I don't think really should be controversial. I think that you can teach empathy to people. Some people think that, empathy can't really be taught, but I think that, with practice, with time, with understanding, maybe with, medicines like MDMA in a very controlled setting, you can in fact teach someone how to be more empathetic. And through your research, I imagine if you're researching empathy, then your end goal is for people to use the strategies and tools that you're studying to become more empathetic overall. Is that correct?
Perhaps. It's part of it. The main goal, like the primary thing right now is that there's still a lot of questions to be answered about empathy. there has been a lot of really good research that has answered most of the main questions, like what brain areas are involved and, what makes someone feel empathy versus makes them not feel empathy. But as far as in the drug context, like with MDMA, there's a lot of unanswered questions about the mechanism. And we know, or at least we think, that MDMA is an empathogen. If you look up the term empathogen, they say, for example, MDMA. However, and an empathogen is something that brings out empathy, makes you feel more empathetic. But the mechanism of how it's doing that is not really pinned down. So the primary goal of my research is to do that first, right? To figure out what's going on. And it may not be necessarily to lead to some sort of intervention, but it creates the potential for that, where once we understand what MDMA is doing, then maybe we can create something else or find something else that does that one thing that MDMA is doing to increase empathy without all the other things that MDMA does to make you feel, energized and grind your teeth and whatever. It's, all these methamphetamine like responses that it induces.
And when people do use these medicines, do you feel like sometimes they experience empathy just during the time and then it kind of wears off after? Or are there studies that indicate that, if you use this in a controlled setting over time, the empathetic traits or the empathy that you feel when you're on the medicine can actually be felt even when you're off the medicine?
Yeah, it's a really good question. So there are studies, there's one study specifically I'm thinking of that has shown that recreational MDMA users, those who have taken it repeatedly, have higher levels of empathy at baseline without MDMA than members of the general public, people who are not in that group. And it's a bit hard to interpret that finding because it's like, well, are they more empathetic because they've done MDMA so many times and it's really become a part of who they are? Or is there maybe something else there that people who are naturally more empathetic, who connect with others more, are more inclined to use a drug like MDMA that has these powerful social effects? And so since they're so empathetic, they enjoy the drug, so they use it more. It's like a chicken or the egg kind of thing. But yeah, it's hard to know for sure. But I mean, of course, there are anecdotal examples. A story came out recently, a couple months ago, that was super interesting, where apparently this guy who was a white supremacist took MDMA and had this experience of, they didn't talk about this in the article. I kind of deduced this based on my understanding, that he had this like intensely empathetic experience. And for the first time, maybe in his life, he stepped back and was like, oh, maybe people who aren't white are actually like my family too. Like we're all in this together. Like this deep empathic experience that he hadn't really had before. I'm assuming a lot there because I don't know that. But what happened in the end, what was reported in the story, was that he came out of this experience like totally changed, and he dropped his views and was like, no, forget about white supremacy. Like we're all in this together. I love everyone. And so there's a clear example of a person whose experience had a permanent impact on the way that they view the world and the way they think. So it's definitely possible.
Yeah, I think too, you're right too, like whether like the chicken or the egg, and don't get me wrong, I do think that MDMA is an amazing medicine. And yes, we do need more research on it. But, from what I've seen anecdotally and through some of the research, I mean, it does seem like it can be an incredible medicine when it's used correctly under the right conditions. But yeah, I mean, when you're talking about empathy and people, not maybe being willing to use a drug versus not. So, I hate to bring up someone like this, but someone like Andrew Tate, for example, like that guy, I think could use maybe an MDMA session. And I think that would do a lot of benefit for him. Right. But he would be
Agreed.
The exact example of someone who's like, no, I'm not going to touch MDMA. So like he may just be less, well, we know that he's probably less empathetic at baseline, like compared to other people. Whereas, some people who, want to use MDMA, they may have that kind of baseline empathy higher. So it is kind of difficult to understand. So I understand that, there's going to be a little bit more research there. Do you have something to add there? Yeah.
Right. I mean, because there's a difference between someone who has never thought about the perspective of someone who's unlike them. And there is, there's natural, this is a part of the brain. For whatever reason, human brains empathize less with people who don't resemble us. And it could be race, sex, religion, political view, whatever, like anything that we can use to distance someone from ourselves, like, oh, they're a different religion, whatever it is, our brains naturally engage in empathy to a lesser degree because of that. So there's a difference between someone who just naturally doesn't empathize with someone else versus someone who actively hates another group. And the people in the latter group who are hateful and, discriminatory, those people are going to be the least likely to take a drug if they're being told, oh yeah, like take this drug and then it's going to make you love those people you hate. Obviously, they're going to say, no, I'm not going to do that because it goes against my fundamental beliefs. So there's sort of a difference between like active versus passive discrimination in that way, which might change how people adopt some sort of treatment like that.
Yeah. And it also gets a little bit complex too. Like, if you mix in someone like David Goggins. Okay. So I like David Goggins, right? I think he's great, but he's not for everyone. Like, I totally get that, like I'm just someone who kind of responds to that military discipline type of thing. And it works for me, but I totally understand that, like, it doesn't work for everyone. Like, if David Goggins starts yelling at people, like 50% of people are probably just going to like quit and cry. Right. But would you consider someone like David, like obviously he has helped a lot of people. A lot of people do think that what he's saying and preaching is effective and can be effective in certain individuals' lives. Like, would you say someone like that does have empathy, even though it's not maybe from the traditional sense?
So this is where I think the distinction between cognitive and emotional empathy becomes really important. I think someone like David Goggins has probably a lot of cognitive empathy because they can step into someone's shoes and say, where is the barrier, right? Like, what is holding this person back? I can understand their perspective and I can drive them through that barrier. But in order to do that to the level that he does, you need to sort of lack emotional empathy, because if you're going to be screaming in someone's face and making them feel terrible, you need to be able to distance yourself emotionally from that and not sort of catch that emotion from them, right? Because if you're also emotionally empathic, then it can prevent you from doing that to someone. Because you observe and take on their discomfort. So he's probably like one of those people who's really high cognitive empathy and maybe naturally low emotional empathy, or maybe he purposely just sort of can shut it off and distance himself from it, which is also something that people are capable of. Like a physician, you working with a patient that's in severe pain, over time you can get better at sort of just shutting it off and being like, I'm here to help this person. I need to understand them, but I'm not going to just sit here and get uncomfortable because I'm seeing them in pain. I have to be able to separate that,
Yeah, there's definitely with empathy comes into like, tough love versus soft love. And, again, that's a very difficult thing to balance out. And there's no real perfect equation for that. Like, when does your child or when does your spouse or your friend or your family, need tough love versus soft love? But I think that, both can, you can have empathy for both. But from what you're saying, and please correct me if I'm wrong here, but if you have cognitive empathy versus emotional empathy, it seems like the cognitive empathy may be more of the like, pull up your bootstraps kind of tough love sort of thing. And the emotional empathy might be a little bit more of the soft love, like, I understand your pain, I understand what you're going through, and I'm here for you. Is that sort of how it's distinguished, or am I way off on that?
No, I mean, what you're saying makes sense. I suppose the only distinction I'll make is that like cognitive empathy and emotional empathy go hand in hand. Like, they traditionally occur at the same time. Okay. But I guess in the example of David Goggins, like in order to successfully pull off that type of tough love, I think you have to disengage emotional empathy. But I mean, really, they do go together. And in a way, I mean, cognitive empathy is required for emotional empathy because you can't feel someone's pain without understanding what they're going through. So it's sort of like a stepwise thing in a way, but they definitely like happen together. It's just that people might differ in the levels that they engage either or both of those things. Like people typically, emotional empathy is a much more strong experience. It's a lot easier to understand what someone else is going through, a lot more natural to do that than to really take on their emotions. And then you have people who can't control it. They absorb. They're like a sponge, like empaths in a way. they take on everything. They take on all people's emotions. And that can be,
Draining.
It could be draining for sure. But it can also be super advantageous, because if you are able to like very finely and with extremely high resolution sense someone's emotions while you're interacting with them, it can allow you to like tailor your interaction to walk that careful line between, in this case, like in this discussion, like gentle love versus tough love. If you can start giving a little tough love and you can immediately sense that feedback and tone it back, so like that's, I don't know. It's a dynamic thing. It's a moving thing where it's not as simple as like sometimes you have cognitive, sometimes you have emotional empathy.
Yeah, and I think too, like different people will respond to different things, and how you're brought up. Obviously, what sex you are too. Like I would imagine 90% of people who follow David are probably male kind of thing, and they're probably mostly males in their 20s, 30s, 40s, so there obviously is going to be a little bit of a change depending upon, who you are. And then just coming back to empathy for a sec, like the baseline, like, do you ever see, or have you ever seen in studies that like, people who have low empathy were, raised a certain way, they had certain parents with certain parenting styles versus people with have high empathy comes from, different backgrounds with different parenting styles? Like how does someone generally fall into low empathy versus high empathy or somewhere in between?
Yeah, I definitely believe that empathy is learned. And you actually mentioned this at the very beginning. I forgot to comment on it, that empathy can be learned and can be taught. I totally think it's, there's the nature versus nurture thing. I definitely think empathy it's something that's natural, that most people have empathy naturally. If they don't, then they would have a condition like psychopathy. But it's natural, but it can be nurtured, and it really is deeply nurtured through your upbringing. Anecdotally, just talking to people, those who were taught empathy and who lived in households where empathy was emphasized, they seem to have extremely high levels of empathy in adulthood. But there's also, another example of this is, for example, children who were raised with pets in the house, and as adults, they show much higher levels of empathy toward animals, that they just understand and put themselves into the perspective of animals. Which to me shows very clearly that, empathy can be taught and is learned through experience.
Interesting. Now, one thing too, with regards to empathy and say something like PTSD, post-traumatic stress disorder. And I heard Chris Williamson talk about this. I forget who he was chatting with, but, he was talking about like, so, cause you just mentioned, not having empathy, essentially you're a psychopath. And so, why is that trait, even reproduced sort of like in society kind of thing, if, because we don't want psychopaths. And so it's kind of, the way he explained it, I forget I always like to give credit to the person he was talking to, the doctor, but I forget this time. But anyways, they basically said like, back in the day, if you were, a Viking or something like that, like maybe you would want a psychopath on your team because you'd want to, go destroy someone, as bad as it sounds, and then, not feel guilt about it, and then just kind of soak in the riches sort of thing. But, we don't really necessarily live. We do live in a world where people are still doing that, but, is there, I don't want to say a benefit, but like, why do you think that trait is still, perpetuated throughout human society? That like, why are there so many psychopaths, I guess is the question.
Yeah, it's a super interesting discussion. I want to, like you said, giving credit. There's a really good book on this, not on this specific on psychopathy, but it's called Survival of the Sickest. And I totally recommend it for anyone who likes this type of stuff. It basically talks about a bunch of different conditions and how they, at one point in history, may have been advantageous, but now they're just sort of like remnants and artifacts of a previous time where it was beneficial, and now it's like a disease. And this is exactly what you're asking about with this. You pointed out a great example at one point, maybe in a warrior culture, that being a psychopath would be the best. Like, you're great at your job, right? You just kill people. You don't care. You just go about your day. And then you go home and sleep well. I would say that evolution in like survival of the fittest and, passing along genes and whatever genetic dispositions that are the best for society doesn't really work as well with this type of thing because, I guess there's nothing preventing a psychopath from procreating. There's nothing preventing, in most cases, there might not be anything preventing a psychopath from finding and procuring a mate. So it's something that just sort of naturally gets passed along. But aside from that whole evolutionary perspective, it's also something that can just happen spontaneously. So some sort of genetic disposition or maybe some sort of experience in utero, in the womb, where this person is just born with certain brain areas that don't engage as much in social interactions, and therefore they feel less empathy, with those brain areas being the ones that are involved in empathy. So it can just happen.
That's very, very interesting. And yeah, something that I think I'll circle back on. And I really appreciate you mentioning that book. Sorry, what's the name again? One more time?
Survival of the Sickest.
Survival of the Sickest. That's a very, very interesting title.
It's a great, I'm looking for it in my bookshelf so I can give you the author, but I can't read from here. Where is it?
It's not Survival of the Fittest, Survival of the Sickest. I'll remember to remember that one. That's good.
Yeah, awesome. It's a real good one.
Okay, so people have, obviously, different kind of, levels of empathy, and obviously it's going to translate into how they treat people as well. But with regards to MDMA and SSRI, so, you kind of said that, and you were not really entirely sure why MDMA is working, and why it makes people necessarily more empathetic. But what about SSRIs, or selective serotonin reuptake inhibitors? Like you said, like it's kind of confusing because, we think MDMA gives us burst and, essentially dopamine and serotonin at the same time, which is why we feel so good. And with SSRIs, we don't get a burst, but we have, more serotonin circulating around again, because it's blocking the reuptake of serotonin. So has there been any research done on these types of medicines making people potentially more empathetic? And it doesn't necessarily have to be like SSRIs, but anything that would increase serotonin. But SSRIs specifically, I guess, would be the first question because, so many people are taking them.
Yeah. So before I talk about SSRIs, I actually want to back up because I have some great news. The paper's not published yet, but I'm happy to just talk about this information. The question of what MDMA is doing, we have figured that out, albeit in a mouse model. So this is mouse neurobiology, but presumably something similar is happening in humans, although we haven't verified it yet. But to make it short, what we found is that, as you mentioned, of course, MDMA, it drives serotonin and dopamine release brain wide, right? You take it, it's systemic, it's throughout your whole body, throughout your whole brain. So anywhere that serotonin can be released or dopamine can be released, it probably will be, at least at higher levels than normal. What we found is that the serotonin release, specifically in a brain area called the nucleus accumbens, that one signal in the brain driven by MDMA was the key thing driving increases in empathy. And there's a whole other conversation to be had here about what empathy looks like in a mouse, but I think that we can get there if you'd like, but let's focus on the pharmacology here. So it is serotonin, and specifically in this one brain area. We found that if we take MDMA completely out of it, and we use something called optogenetics, where you can essentially activate brain cells with light through a complicated mechanism that I won't explain, but you just turn on a light and the brain cell activates. We found that if we just stimulate these serotonin cells and cause them to release serotonin in this brain area, the nucleus accumbens, that alone, with none of the other things that MDMA does, that was enough to reproduce MDMA's effects on empathy. So it is.
That's unreal.
Yeah. So it is serotonin mediated, or at least our evidence suggests that. But what's really confusing, and I'm gonna flop here because I don't know how to explain it. I'm literally working on this section of the discussion right now. It's previous studies in humans have shown that SSRIs actually reduce empathy in human beings. So how is it that acute bursts of serotonin drive this huge increase in empathy, or at least a measurable increase in empathy, while a more gradual long-term stimulation or enhancement of serotonin signaling through SSRIs reduces empathy? And that's a question that I don't have the answer for. I mean, I could get into differences in mechanism. I mean, if you think about it this way, and what MDMA does is it causes a bunch of serotonin to be released, like what we would say super physiological, well beyond what normally happens in your body physiologically. It just happens. It's released. It's forced to release, essentially. But what SSRIs do is when serotonin has been released through your natural physiological or endogenous mechanisms, it just stays in the synapse and then doesn't get taken back in. So that is a key difference, that this is driving rampant serotonin release, whereas MDMA is, whereas SSRIs are just sort of extending or slightly boosting the effects of the serotonin release that happens naturally throughout your day-to-day life. So there is, but it's still impossible to explain why that would have the opposite effect, unless maybe, when I say it's been shown to decrease empathy, it's this one study. Perhaps there was some flaw in that one study that there actually wasn't a decrease. There's no change, which even still is hard to explain. And I certainly can't make any explanations based on assuming that a study is wrong, which would be wrong to do. So it's complicated, and it also could have something to do with the brain area. Maybe who knows what SSRIs do specifically to the serotonin terminals in the nucleus accumbens. It's definitely going to be a topic of future research for sure.
That's very, very interesting. Because, it's like a burst of serotonin increases MDMA, but then like a block of reuptake of serotonin with the SSRI seem to have, again, potentially based on this one study that we're talking about, the opposite effect. But also, too, something that you've posted on about empathy, and this is probably, used even more than SSRIs, Tylenol. So what's this study about Tylenol decreasing empathy? What were the findings there? Like, can you explain that?
I'm so glad you brought this up, because this is one of those things where when I found this study and read it, I was like, I cannot believe that this is real science, because it's one of those, like, I can't wait to talk about this. It's one of those things that's just so cool. It's like a science communicator's dream that it exists. So essentially, to put it simply, this study found that when people are given Tylenol, they report other people's pain as not only being less uncomfortable for them to watch, but also being less uncomfortable for the other person. In other words, taking painkillers reduces your empathy for other people's pain, which is super interesting. And the more I think about it, the more sort of intuitive it seems that if empathy is yourself stepping into someone else's shoes, and painkillers sort of turn off or dampen the areas that encode pain, then it makes sense that you would be less capable of understanding another person's pain if those brain areas are sort of less sensitive to your own pain. You sort of struggle to share and step into their experience, which is just amazing. And of course has a lot of implications for day-to-day use of these drugs, which a lot of people are probably taking.
Yeah. Tylenol is one of the most, prescribed drugs. Especially for older people who can't take NSAIDs or non-steroidal anti-inflammatory drugs like ibuprofen or naproxen. So a lot of people can't take those because of kidney issues or high blood pressure issues. Although I will say, if you are one of those people, I do think that's slightly overblown. So like if you're on high blood pressure pills, you need to take ibuprofen, like just check your blood pressure, after you've taken it. For most people, I find it doesn't go sky high, but definitely something to consider. But yeah, Tylenol is something that a lot of people, again, with pain, are using daily. But would that then transfer over into, like, we can't say all pain medications, because say if you took on, say, something like opioids, I imagine actually may make you feel not maybe more empathetic, but just because there's other kind of feel good neurotransmitters and mechanisms of actions going on with opioids versus Tylenol, meaning like when people take Tylenol, it reduces their pain, but they don't get euphoric. But when some people, when they take opioids, they experience euphoria, which is why they want to take them over and over again. But I imagine that, with opioids, but correct me if I'm wrong, you probably wouldn't see maybe the same effect in the decrease, because they would still be feeling more. than usual. Whereas with the Tylenol, it's just blunting the pain, but it's not providing any kind of high or euphoria for the patient.
So don't quote me on this because I can't think of any specific studies, but I'm inclined to believe that opioids would also at least reduce empathy for pain because of that same idea that it's blunting your own pain perception. So it would blunt your perception of other people's pain. So it's acting on the same brain areas. But there is something else that I'm kind of basing this answer on. Another one of my videos that I did on this was about placebo painkillers. And what's so astonishingly, it's been found that if you give someone a sugar pill and you tell them it's a painkiller, that will also, like Tylenol, blunt their empathy for other people's pain. So just being under the impression that you've been given a painkiller is enough to reduce your empathy for someone else's pain. But what's really fascinating here is that when they gave these people naltrexone or naloxone, I think they gave them naloxone, opioid antagonist. So they essentially blocked these opioid receptors in their brains and then gave them a placebo painkiller that blocked the effects of the placebo painkiller. So what it seems to suggest is that when you give someone a placebo painkiller, it activates the endogenous opioid signaling which is what probably drives that real effect of them perceiving other people's pain as being less severe. So it's like, it seems to, at least in the context of placebo, involve the opioid system, which is kind of why I think that in that case, it would make sense then that opioids would also block empathy for pain.
Unreal. Yeah, that's something that I want to learn a little bit more about for sure, because it's like you said, like Tylenol affecting empathy. It's just not something that you would think you would ever see in research.
Right. Right. It makes you wonder about a lot of drugs too. Like, what else is going on? And empathy is, I'm fortunate to be in the field because there's so many mind-blowing studies like this, but definitely it makes me wonder. Someone was smart enough to ask this question in a scientific setting and publish the study, but what other effects are drugs that people are taking every day having that we haven't studied yet, we haven't figured out yet?
Yeah. And another thing too, with SSRIs now, there's a lot of people have been asking me, particularly over the last 2 or 3 years, and it's kind of, I don't want to say blown up, but a lot of people are interested in sort of like adjuncts to SSRIs. So, people are using other things to augment the efficacy of their SSRI. Like creatine actually is one of them that has been shown in studies. Some of the methylation factors as well. SAMe, I believe, is one. And some other things have come up. Is there anything in your research where you found like an adjunct to an SSRI? Is that something that you guys have studied, or is it something that is not really part of the research that you're doing?
Yeah, no, it's not something I've studied or read about, but it's certainly interesting. But it also gets into, some really, really interesting mechanistic questions about like the pharmacology of these drugs and what they're doing, especially with SSRIs, because last year there was that whole, or 2 years ago, I think now, there was that whole bombshell report where the Moncrief paper saying low serotonin is not the root cause of depression. And then it became a whole big thing where people were like, well, then why are we taking SSRIs? And then a lot of news outlets were misunderstanding and publishing news stories saying SSRIs no longer work, even though we've been using them for a long time, and for many people they work great. It was a misunderstanding, but that's an example I bring up because it shows that in all likelihood, or in a high likelihood, SSRIs are not driving their therapeutic effects by boosting deficient levels of serotonin. It's probably that they have to be boosting serotonin levels. We know that because of how they work. But then serotonin is probably doing something else downstream that's acting on another system or driving plasticity or doing something that's mediating the effect. And so then you think about, okay, well, what could we take to augment those effects? Maybe it's something unrelated to serotonin. Maybe it's the downstream system, or maybe it's another upstream system that's involved in the synthesis of serotonin. Who knows? I mean, that which is why I say it opens up so many interesting pharmacological questions. that are like,
Yeah.
how does all this stuff work?
It is interesting. And again, I won't harp on this too much further, but like the methylation factors, like I mentioned, SAMe, TMG, I think is the name of another one. But then there's also even like PEA was shown to increase the effects of citalopram. L-carnosine was shown in a randomized control trial to increase the efficacy. I forget which one, which SSRI, but very, very interesting in mechanisms of action. Cause like you said, maybe it'll show us something that, hey, like, it's doing something, signaling downstream, and that one of these, compounds is actually, increasing its efficacy. So, let's look into that and maybe hone on that a little bit more than just simply, increasing serotonin. But
yeah, totally. You brought up L-carnitine, which is an interesting one. I've actually never talked about this on social media or anything, but L-carnitine. So, okay, let me back up for a second. I have narcolepsy, which is a sleep disorder where, for people at home, if you've ever seen the videos of like a wiener dog running around and then just passes out, like that's narcolepsy, where you just fall asleep uncontrollably. Luckily, I have really great control over my sleep and my, alertness, that I don't fall asleep randomly. But in my years of having narcolepsy, I've done a little bit of research on, what people take. And there are a few case reports showing that acetyl L-carnitine has been shown to really be effective for people with narcolepsy, with helping them stay alert and stay awake. And I've tried it myself and found that it actually does help a lot. And so I've been really interested in that supplement, as, the mechanism and how it works. And, certainly not giving medical advice, but I always like to, whenever I talk to people with narcolepsy, a lot of people don't know about this because it's really not on the radars of doctors. But there are case reports showing that it can be effective. So sorry, I just wanted to throw that in there while you brought it up.
That's excellent. I mean, that's how, things, get studied. And the thing is that every single drug or every single supplement, anything that you and I have ever taken, or anyone talking this, at one point had no efficacy, or one point had no randomized controlled trials. That doesn't mean that you can say that, it is efficacious because, it worked for you anecdotally, but it does mean that, you can't say that it doesn't work just because we don't have all of the evidence yet. So, I'm definitely looking forward to that. But just coming back to MDMA and SSRI. So, one thing I've, briefly, had some Twitter conversations with, Rob Harris about this, but, most people are told that, and rightly so, that if you are on SSRIs, then you shouldn't, take MDMA even in a therapeutic setting. And then the reason being mostly because of serotonin syndrome, which is, definitely something you not want to experience. Is really, really dangerous. But I have seen at least one study where it showed that now they were only taking it, I think, for 2 weeks. I think it was escitalopram or citalopram. They took, I think, 10 milligrams. I think that you're kind of nodding like the study, like 10 or 20 milligrams for like 2 weeks. And then they took the MDMA, and then they still had, from what I could kind of gather, it seems like the people still had a very good therapeutic session. They may not have just had quite the euphoria that they normally get, but they also, I think, experienced less side effects. So again, massive disclaimer for this, guys. We're not saying that if you're on an SSRI, you should take MDMA. Absolutely not. Like, that's a big no-no. And if you are interested in, doing that, you definitely want to talk to a healthcare professional. I'm really saying this not just to protect me, but to protect you. Because like I said, serotonin syndrome is not something to be taken lightly. But do you feel that, maybe potentially with more studies, there is a way where we could, administer MDMA to people safely who are also using SSRIs? Because again, the big thing is like, people don't want to go through the withdrawal period. Like I think I heard Theo Vaughn talk to Joe Rogan about this maybe 3 to 6 months ago, something like that. He's, very bravely, and I, admire him for it. He said that, he takes escitalopram, I think it was, and he's just said that, he's a better person with it. He doesn't want to come off of it. But he did have a really good ayahuasca experience once, and, the active ingredient in ayahuasca is, extremely psychedelic. So, it's DMT essentially. So, with all that being said, what's the latest research on SSRIs and MDMA, and how dangerous is it?
So I want to read that study again that you're talking about to really pin down what they found. But I know exactly the one you're talking about. So the thing about SSRIs and MDMA is that SSRIs act on SERT, S-E-R-T, the serotonin transporter.
Yeah.
And so does MDMA. But apparently, SSRIs are more competitive. They outcompete MDMA to bind and interact with SERT. So what happens allegedly, or presumably, when someone's on SSRIs and they take MDMA, instead of MDMA doing what it normally does and driving all this serotonin release, the SSRIs are kind of like blocking this transporter and are like, no, get out of here. This is my molecule here. And what happens is MDMA is not able to drive this release of serotonin like it does in people who aren't on SSRIs, which is why that study that you're referencing is so interesting, because it kind of starts to tell us what would happen, or what does happen when MDMA is able to do everything but act on serotonin. So it's able to act on dopamine and norepinephrine, but not necessarily on serotonin, or at least not to the extent on serotonin. So it's funny because actually in Boris Heifetz, who you had on the show, in his experiments in mice, he actually used escitalopram for one of his experiments where he wanted to test exactly that. If we block serotonin, we kind of take serotonin out of the equation and not let MDMA act on it, then what happens? So it's actually that powerful. It's that competitive of the
transporter.
Yeah, in the way that it acts on the transporter. So I don't want to speculate on serotonin syndrome. I mean, it's definitely it can be very, very serious. So you want to take all precautions. But it would seem perhaps that the people in that study were actually less prone to serotonin syndrome because MDMA wasn't able to act the way it does in people without SSRIs.
That's kind of how I interpreted it as well. And it's like, we've always been told, and like I just said, it's like the strongest medical disclaimer I've ever put on this podcast, I think. but like that's how I interpreted it as well. It's like these people are actually experiencing less of the, I don't want to say euphoria is like bad. Like obviously euphoria is a good thing in some senses, but they are experiencing less of this like high, but they still seem like they were getting the therapeutic effects. Like that's kind of how I interpreted it. Meaning like, I think like the talk therapy and everything like that went well. They just didn't feel like they wanted to, listen to house music kind of things, so to speak, and got that super kind of high feeling. So that's interesting. And again, like, we're saying this with a big disclaimer, guys, don't mix these drugs. But what we are saying is there is maybe potential in the future, once we've done more research, to see potentially that, someone on SSRIs, could use MDMA safely, potentially. Because again, the people who you would think would need MDMA the most would be the people who are already on an SSRI, who are already, treating themselves for depression, anxiety, or PTSD, or whatever it is. So yeah, thank you so much for clearing that up. I super appreciate that.
Yeah. And just to add a note on that, I mean, if what we're saying is all true and accurate, which it's hard to know for sure, because it's such in-depth pharmacology. But if it is true, then that would mean that when people on SSRIs take MDMA, it actually acts more like methamphetamine, in that it acts on dopamine primarily and less so on serotonin, which is could be an unfortunate thing, because if MDMA's therapeutic effects are partially mediated through serotonin, then it could be taking away some of that. And that's, I really got to touch up on that study. As soon as we hang up here, I'm going to read that thing again. I wish I would have done it before we talked.
No, I should have maybe sent you that question before, but it does, certainly, throw a curveball into the whole MDMA SSRI thing. And like I said, like the reason why I'm so interested in it is because, like, my patients who ask about, whether it's microdosing or MDMA or whatever it is, those are the people who are already on SSRIs,
Yeah.
so it is something important for us to, try to tease out in the literature.
Yeah. And as you mentioned, weaning off of an SSRI is a long and arduous process that can have side effects and stuff, unfortunately, which is another reason why, all of the psychedelics being explored are such a, have that huge advantage that it could be a one and done kind of thing, or, hopefully there's no, there's fewer side effects and it's less of a commitment.
And also too, I mean, again, like, I don't want to say that I, don't prescribe SSRIs. I still prescribe SSRIs when it's, clinically indicated in the right context. I certainly do try, to get people to, do all the behavioral things, nutrition, diet, and all that. But, some people do need extra help. And, unfortunately, it's difficult to prescribe some of the other things that we're talking about. But one thing too that I wanted to chat with you about today is non-deep sleep rest. And the reason being because it kind of ties into what we're talking about now with, potentially things you could do to increase your neurotransmitters, and particularly dopamine, I think, is the big one with non-deep sleep rest. And so, if you're someone who, wants to reset your dopamine, which I think a lot of us need to do, because there's, we're certainly all doing too much scrolling and, too much just general sort of like entertainment, screen time, things just flying in our brains. And so if we want to really relax, I think we need to, make a commitment to do that. Like, it's not just going to happen. You have to schedule it, like you schedule a haircut or schedule, a massage or an appointment or whatever it is. And so, what is the benefit of non-deep sleep rest in restoring dopamine?
So I will say that's a topic I haven't read up on recently.
Okay.
But I can tell you that in my experience doing non-sleep deep rest or yoga nidra, I feel so good. I mean, it's amazing. And maybe it's because I have narcolepsy. There is an element there, but I think I'm not alone. That a lot of people say, man, I feel good after this. I mean, one of the best days that I've had in the last 5 years was I woke up and I did an hour of yoga nidra, which it's tough because you're not moving. And I'm not, for anyone who can see the footage, but I'm a pretty fidgety guy. I like to move around a lot. I'm just kind of always moving. So it's to lay still for 1 hour. It's probably something I haven't done since birth. So it was transcendent, and I was left feeling amazing. But I don't know. It kind of raises into my mind, like you were just talking about, like pleasure seeking behaviors, I suppose. Pleasure seeking in not a traditional sense of like maybe drug use or things like that, but just the fact that we constantly have the ability to pull out our phones and get lost in a sea of tailored content that hits all of the things we love. That's a kind of a difficult world to live in when you have responsibilities. So to be able to step away from that and do something like non-sleep deep rest, or, sitting in a hot tub and looking up into the stars, like I'd be curious about how something like that compares, like about the benefits of non-sleep deep rest. And again, this is a topic I'm not really deeply versed in, but whether those benefits come from simply detaching and spending time focusing on rest and relaxation and avoiding pleasure seeking, or if it is just that we're avoiding, we're resting, is it that we're intentionally still and we're focusing on the sensations in our bodies, or could a part of those or all of those benefits be driven by just the rest itself and the joy, the pleasure of it, like hot tub?
I mean, I use a sauna a lot. And again, like, I'm not someone who preaches about, it's definitely going to decrease atherosclerosis. It's definitely going to decrease all-cause mortality, which, a lot of those things actually have been shown to be, studied in research, especially the 20-year Finland study where, it seems like the more they use it, the more health benefits they get. But even if all that wasn't true, like even if there was no studies, if you would, typed in sauna in PubMed and there was nothing there, like I still just enjoy doing it.
Right.
Like for whatever reason, like, at the end of the day, after I sauna, I just feel better. And I have this like craving to do it, and then I just feel better afterwards. And I think that, you know, the non-deep sleep rest, the Nidra yoga is probably the best example of that. But people can probably find, you know, other things like you mentioned, you know, just looking at the stars in a hot tub, like other things that maybe can, you know, restore your dopamine or maybe make you just slow down or force yourself to slow down, that eventually will just make you feel better, you know, as simple as that sounds.
Yeah, it exactly. I mean, it sounds so simple, but it is so true. It's like if you can find anything that gives you that sense of pause and relief and just sort of calmness, that is invaluable. And for some people, that might be scrolling on TikTok, but I'm sure that that's very few people. And I bet,
Yeah.
you know, if you were to ask those people to actually deeply reflect on how they feel after they close their phone, probably they're going to feel pretty bad. You know, there's a lot of evidence showing that social media use just generally has negative effects on people and mental health. So, you know, it is simple advice, but it's so important for people to simply take some time to contemplate and interrogate how the things that they spend their time doing impact their well-being and their happiness.
Yeah, I agree. And I know you have a couple minutes left. I got to let you go there. But yeah, I think that, you know, there's one really important thing there. I think that, yes, like we said, you know, finding a practice, whether it's, you know, non-deep sleep rest, yoga nidra, whether it's, you know, sitting in a hot tub, looking at the stars, or, you know, getting into a sauna, all those things are wonderful. But at the same time, what was probably even more powerful than that is decreasing your inputs, you know? So like the social media in particular, and you've posted about this, you know, I know that you posted a study. There was where people taking a 1 week break from social media really increased their overall well-being. I don't know the exact conclusion of that, but essentially that was kind of it. And so, you know, don't just focus on, you know, what can I do to combat it? You know, make sure that you focus on what you do so that you're not taking in more so that you need to do more and more, you know, of the yoga nidra, of the sauna and all that. And I'm not saying that you will get to a point where we won't need to do anything or any self-care like that, but you'll certainly get to a point where you maybe need to do less, so you'll crave it a little bit more often just by decreasing your inputs. Yeah, there was so many things that I wanted to chat with you about today. We got through a lot of them, definitely not all of them, but we definitely got through a lot of them. And I've really, really enjoyed chatting with you today. But where can people find you online? Where can they learn more about your research and watch your videos?
Yeah, so first off, likewise, I mean, this has been a great conversation. I, again, appreciate you having me. The simplest place to find all my everything is my website. So it's just BENREIN.com, just my name. And that'll take you to everything. You know, you can find my papers on there. There's no paywalls if you're interested in that. If you are, God bless you. If you want to see my social media, it's on there. You want to contact me directly. I also have some resources for students in science, lots of things on there. So that's the hub where you'll be able to find anything. And I appreciate your interest in even thinking about it.
Well, amazing, guys. Like, definitely go follow Ben. He's a wicked follow on Instagram. Just go do it. You'll definitely learn a lot. Thank you so much again for coming on. I really do appreciate it. And as always, I'll be back again next week.